The main driving factors, I think the first one is that the former policy from 1997 was quite outdated. And as a result, a lot of the stakeholders and the structures that were identified in the old policy were reformed or either not in existence anymore. If you look at the change of ministries, especially the names and the transition of their mandates as well, with the transition of the various governments. Additionally, after the adoption of the former policy, Namibia as a country ratified the UNCRPD, the United Nations Convention on the Rights of Persons with Disability. And with that ratification, the new obligations and international duties arose for Namibia as a country relating to the rights of persons with disabilities. As a council, we also did a situation analysis where we traveled through the entire country and consulted with various persons with disabilities in various geographic areas and regions. And we found that some of these solutions were then needed to be incorporated into an updated policy. Those are the primary reasons for the change and the revision of the policy.
So just elaborate a little bit more about how this revised policy will differ from the previous one and what key gaps it aims to address exactly.
The first, I think, key change with the new policy is the expansion of the special target groups. With our old policy, the 1997 policy, we only had three target groups, which were women, children, and the elderly with disabilities. And with the new policy, we have now included inmates, offenders with disabilities. We have included persons with severe mental and intellectual disabilities. If you take note, Honorable Lewindaw has also recently tabled the mental health bill because research has indicated that persons with mental and intellectual disabilities have largely been left behind with the disability initiatives. We have also included indigenous minorities. With the cabinet adoption of the national policy of disabilities, we no longer refer to the marginalized community, but they are now termed the indigenous minorities of Namibia. So that is the first key change within the policy. Another change within the policy is that there's specific focal areas that government will focus on. So with a shift from the former medical model in the old policy to the social model, the government will now, in its developmental agenda, look at what are the social barriers for persons with disabilities and how can these be removed through specific focus areas such as accessibility, access to information, data collection, and data relating specifically to persons with disabilities. We are looking at employment, healthcare, education, all sectors that relate to persons with disabilities. So that is also something that we really appreciate within the policy. And I think what is very, very important is the costed implementation action plan. Like Her Excellency the Vice President said at the launch of the policy, that a policy is as strong as it is implemented, and there's no point in having a very comprehensive policy if it's lacking in implementation. So for the first time, the policy is accompanied with a costed implementation plan, which gives a clear roadmap and direction in terms of what is expected from which stakeholder and how much it will cost to implement the policy.
So could you briefly explain the process that went into developing the policy as well as the costed implementation action plan for 2025?
We had three drafts of the policy, and it was unfortunate that when we came up with the first draft was done after we conducted a situation analysis. We did some desk research, and we consulted various stakeholders and persons with disabilities with the gaps and the needs that they have. And then we drafted a first draft, and we also aligned it with our regional and international and domestic frameworks. The second draft, I think, was unfortunate because that draft, when we had to consult it, was during the period of COVID. And for a few years, it actually set us back. But during that period, we submitted the policy to all stakeholders for written commentary. And we then included those comments into the second draft. And the third draft, now last year, 2024, we traveled the entire country to all regions, consulting physically through engagements and consultations with persons with disabilities, your stakeholders, to get input into the policy. And we then tabled it to to Cabinet. We submitted it to the National Planning Commission, who heads policy review processes, and the Attorney General's Office for Certification. We tabled it at Cabinet, and we were so pleased that on the 9th of July, we got adoption of the policy, and the Prime Minister, Right Honorable Dr. Ngurare, then gazetted the policy on the 15th of October, which brought us to the launch on Monday.
So, Jessica, just talk to us also a little bit about how this policy translates into tangible improvements for persons with disabilities across the country.
I think there's two key factors to look into, and it's the language in the policy is not aspirational, but quite practical. The solutions that have been proposed or that are proposed in the policy are quite practical in terms of how government is going to ensure the inclusion of persons with disability. Like I said earlier, the developmental agenda is something that's quite important. I think for quite a while, persons with disabilities have been treated as a welfare matter, where grants are provided, and the issue of persons with disabilities was deemed resolved. However, with the new developmental agenda, when you think of housing and sanitation and you think of employment, you can now see in terms of a ratio to what extent persons with disabilities have been excluded. I also want to cite that the policy speaks of a monitoring and evaluation plan. In the monitoring and evaluation plan, there will be an interagency committee, which will be established from various stakeholders, including persons with disabilities, that will monitor and evaluate if the policy, how it is being implemented, and if it is practical in terms of the needs of persons with disabilities. We also have the implementation action plan that I cited. It gives key activities and performance indicators, and it also outlines which stakeholder will be responsible for implementing which strategy. And that will then also aid government to hold the various stakeholders accountable for the implementation of the policy. And we trust as stakeholders, as a key leader of this project, that that would definitely bring some impactful change for persons with disabilities.
So what mechanisms are now in place to ensure that government ministries and stakeholders effectively implement the policy's action plan?
But it's what I've actually just stated. Those are the strategies in place. The implementation action plan will be the roadmap that will guide our stakeholders to implement the policy. If I can give an example, our first policy objective, the first strategy, is accessibility to infrastructure. Now, under that policy objective, we have identified the Namibia Standards Institution, as well as Office of the Prime Minister and Ministry of Works and Transport, to develop standards that are going to guide the accessibility of persons with disabilities to buildings, to transport, as well as ICT. So that would be the first strategy, and through the identified stakeholders, if once those guidelines are developed and adopted, you will then definitely have to apply them to your building infrastructure to ensure that persons with disabilities will have access to the building environment in the country. So that's just an example in terms of how the policy will be implemented moving forward.
Well, I think you have just answered my next question, which was how will the voices of persons with disabilities continue to be included and represented during the implementation phase?
Yes, for persons with disabilities, we have also a strategy that relates to the organizations of persons with disabilities, as well as the caretakers and caregivers and parents of persons with disabilities. And through that empowerment, we will then definitely, and there's in the policy, there's a provision that speaks to self-representation. In self-representation, it requires that persons with disabilities have to be involved in the decision-making, planning, and implementation as well of this policy. And that would give them a loud voice in terms of how their needs need to be met in terms of the policy as well.
And finally, what are the next immediate steps following the launch to ensure that building an inclusive Namibia from policy to action becomes a lived reality?
You see, I think, firstly, after the launch, we have received so much positive feedback There's a lot of excitement. A lot of stakeholders have already called to get a copy of the policy and the implementation action plan. And we trust that the policy is very clear. It gives clear guidance. It gives clear expectation. It gives clear indication of how stakeholders will be held accountable and what would be required from them. And it is a totally different document than the 1997 policy. And we also have faith in the feedback that we have received and collaboration with our stakeholders throughout this drafting and review process of the policy. And we're hopeful that collaboration will continue stronger to make sure that persons with disabilities are included moving forward.